This is how I'd like a presentation of a gastroenterology consultation to be done. The basic tenet you have is to tell me a story of why we are being asked to see this patient. The chief complaint should be summarized in one sentence. The history, which is the most important part, start with the age of the patient, why we're seeing the patient, what's going on, when did it start, what's the character of the pain, if there's any pain, does it go anywhere, how long has it been going on, is it continuous or intermittent, what makes it better, what makes it worse, any other associated factors. Next, the pertinent past medical history. I don't want to know that the patient had a tonsillectomy at the age of 2. Next, the past surgical history, especially any abdominal surgery or any cardiac surgery. Next, I'd like to know when the last upper endoscopy or colonoscopy was done, if it was done at all, and the pertinent findings. Next, I always like to know what the allergies of the patient are. Next, the medications that the patient is taking. Then we'll get to the pertinent family history. Basically, if they've had any family history of liver disease or GI cancers or ulcer disease. Next, the social history of the patient, specifically alcohol, drugs, and tobacco. Then go to the physical examination, the vital signs, basic chest exam, and the abdominal exam. Measure the size of the liver, check for hernias, and if appropriate, do a rectal exam. In liver patients with abnormal liver function tests, check for asterixis. Next, I'd like to know the pertinent labs, specifically the BUN creatinine, liver function test, hemoglobin, amylase, lipase, thyroid, and anything else that you think is pertinent. Next, I'd like to know the results of an ultrasound or CT scan, findings if it was done. Finally, this is the most important thing, I need your impression. Within 2 to 3 sentences, summarize why we're seeing the patient and what you think the problem is. There's no need to regurgitate the history and physical noted above at this time. Last thing is your plan, what you think needs to be done, and we can discuss this per patient. Thank you. For GI bleed consultation, this is the algorithm I normally go by when I evaluate a patient. Always start off with the history, how long has it been going on, try to differentiate whether it's an upper or lower GI bleed, ask them if they have hematemesis, coffee ground, bright red bleeding, or hematochezia, ask them if they've had any abdominal pain. Always ask them about aspirin use, any anticoagulant use, and alcohol use. It's unusual for them to have an aneurysm repair done these days, but we should ask them that. Ask them if they've had bleeding in the past and how it was evaluated and what was the findings. Next, make sure you give me a list of the allergies and their medications, especially over-the-counter medications. Past medical history is basically only pertinent, important past medical complaints such as diabetes or heart disease. Past surgical history, if they've had any abdominal surgeries, that's all I really want to know. Physical examination are self-evident vital signs and their abdominal exam. Check for any abdominal scars. Make sure there's no aneurysm. The labs, I need their white count, their hemoglobin, their platelets, INR, BUN creatinine ratio, which will indicate to me whether it's an upper GI or lower GI bleed. Their liver function test, and occasionally amylase and lipase. Radiographic studies, if they've had an ultrasound or a CT scan, to check for ascites. Finally, what do you think is going on with the patient? Do you think it's an upper GI bleed or a lower GI bleed? And what your plan is. Typically, we should keep them NPO, put them on a proton pump inhibitor, do labs, checking their hemoglobin every 8 hours. And do you think the patient needs an endoscopy or not? Oh, I'll add, you need to ask them if and when they've had a prior upper endoscopy or colonoscopy.